65-year-old Abdia Abdullahi is among hundreds of people in Mandera County who have been affected by chikungunya. The virus is transmitted to people through mosquito bites. The disease usually shows up about 3 to 7 days after someone is bitten by an infected mosquito. Abdia says she was feeling unusually tired during the day and her back began to ache.
Lakini magonjwa ya kushika meli yote tunaona leo tu, tunastaajabu kabisa, hata nashinda kuondoka, mguu na katika, mkono na katika, hata galasi ya maji watoto nachukia mimi mdomo.
The virus is generally not lethal and can't pass from person to person, but the pain it brings can be horrible. For 3 weeks, Abdia lay in bed. Her 4 children were not spared. They too were affected.
Lakini hawa wamekuwa mzuri. Mimi tu ndio nashinda kuondoka. Sijui shauri ya kuseika tu mimi nafikiri. Na tena tunasikia sijui jina yake inaitwa nini? Kikanguju sijui nini? Kadut kwa Kisomali kadut.
Chikungunya has affected more than 700 people in Mandera County. Symptoms of chikungunya typically last about a week and include fever, rash and severe arthritis in one or more joints. There is no treatment or vaccine for the disease, but for patients like Abdia, pain is managed with painkillers to relieve fever and muscle aches.
Tunatumia maji, tunachukua Panadol.
The chikungunya outbreak has worsened the cholera situation as some patients suffer from both diseases. Kenya Red Cross has constructed a 60-bed cholera treatment center at Moi Stadium to help in fighting the outbreak. 18 people have died from cholera since the first case was reported in April, and the number of people infected has increased to 1,337. The cholera isolation ward is run 24 hours a day, attending to the growing needs of patients seeking urgent medical treatment. Most of the cholera casualties are children, women and the elderly whose body defense system is too weak to resist the cholera bacteria.
We keep rehydrating them until such a time that they are stable enough, the number of motions have gone down and patients are stable.
Patients continue to stream in. Most of them are brought in while in shock and in the late stage of the disease, making it difficult for the team to handle. The outbreak has affected the entire town and its environs. Areas bordering Somalia are the worst hit.
There was a lot of mortalities because, one, the number of health workers who are in the county were not able to respond to the large number of patients who are getting infected every given day. So 60% of the medical staff were down with chikungunya virus, and this gave cholera the freeway to do what it wants in the community.
The twin outbreaks of chikungunya and cholera has taken a toll in Mandera County, leaving most households affected either by one or both disease. This has equally slowed down a number of economic activities in the region.
So far from the time we admitted patients into this camp up to now, we have had 0 mortality, and this is as a result of the robust intervention by the medical people. We've given ourselves a maximum of 2 weeks to contain this.
Most of the hotel eating houses in town have been closed down, so we expect this to have a very huge impact on the cholera outbreak.
Public health officials are struggling to contain the chikungunya virus, in part because of the difficulty of limiting mosquito breeding grounds and because the disease is so new to the area. Medical personnel have been dispatched to scale up efforts to prevent further spread of cholera and chikungunya in the north and across the border. At the same time, locals have been advised to use mosquito repellents and sleep under treated mosquito nets.
There are teams that are in the field trying to do public health education, trying to educate the community in a way to manipulate the mosquitoes at household level. There is also a bigger plan by the county to be able to spray Mandera town and to be able to reduce the population of the adult mosquitoes.
The sanitation situation in Mandera is critical, with erratic water supply and inadequate sanitation facilities. A water treatment facility run by Red Cross is serving the community with clean water to end cholera.
Chlorination of water sources, and this chlorination is being done twice a day, very early in the morning at 5:30.
Additionally, teams are working to disinfect patients' households within 24 hours of their admission to the cholera treatment center to avoid further spread of the disease in the camp. The spread of the viral disease in Mandera has been blamed on the lack of coordination between the national and county government's health sector. According to the Senate Committee on Health, the surveillance officers meant to keep track of the disease have been moved without appropriate replacement.
By the time you're coming as national government, there are people who are already overwhelmed. And remember, these don't have boundaries. They're spreading very fast from one county to the next one. We need to rethink about how we are responding.
Is it fair to say the national surveillance system is itself dead, it's not working? You have left things to counties.
For now, medics will continue to monitor patients like Abdia until the twin outbreaks of cholera and chikungunya have been contained. Wangui, NTV, in the county of Mandera.